Now, may I please request our distinguished speaker, Mr. Dipendra Chaudhary, to enlighten us all. Dr. Dipendra Chaudhary is an orthopedic surgeon, a specialist in joint replacement and sports medicine at Sir Gangaram Hospital and consultant at Christian Medical College and Hospital, Ludhiana. Sir has also been a recipient of various fellowships, namely Joint Replacement Fellowship from Sir Gangaram Hospital, Medicine, King's College Hospital, London, Advanced International Joint Replacement Fellowship, King's College Hospital, London, and AO International. Over to you.
Good evening. I'm Dr. Dipendra Chaudhary, and I really thank you for your kind words. And I thank Madam Viva Khosla, the principal of the Global School, for giving me an invite to be connected to all the lovely parents and the students of the school, and also the other audience. As Madam Khosla already mentioned in her brief, that movement is so important. In our orthopedics, we usually say that the life is movement and movement is life. So without movement, there is no life actually. So I am a knee surgeon in Sir Gangaram Hospital. I do joint placement and I also do the sports medicine injuries. So I would be talking briefly about both the most common those problems which do affect our communities, namely the sports injuries and the osteoarthritic, the degenerative diseases of the elderly. So the sports injuries are more prevalent in the younger age groups, and the osteoarthritic problems, they are mostly a degenerative and they are usually prevalent in the elderly population. So when you talk about the knee care and its maintenance, so we have to, take into consideration all the problems which can affect the knee. So the sports injuries, as I mentioned, is prevalent in the younger age groups. And before knowing that, how can we prevent the injury from happening and how can we then further manage it? It is very important to understand the various risk factors associated with every problem. Because once we are aware of all the risk factors, then we can formulate the treatment strategies and we can prevent those injuries from happening. And so the importance of the risk factors is that it also helps a surgeon to prevent the medicine load in the community. So my aim would be to make you all aware about the various risk factors which you may not be aware of only, that what are the problems that I'm going through. And it is not just that you'll be suffering right away. It may take few years or few months from down the line. So the most importantly, the risk factors which we consider when we talk to the sportsmen of the younger age group is that they should be of good, maintaining a good body index, body mass index. A heavy weighted patient generally would lead to the injuries of the knee with his own weight. And there are certain anatomical factors which play a part, which play a big role in predisposing the knee to the ligament injuries. The most common ligament injury which the knee is subjected to is the anterior cruciate ligament injuries. Just to explain you all that our knee is bound by these ligaments, the anterior cruciate, posterior cruciate, and there are other ligaments on two sides. So the anterior cruciate of all is the most commonly affected injury. And this injury, the anterior cruciate, has certain risk factors, which I stated. First is the overweight, then there are a few anatomical factors, then there's a gender predisposition more in the females because of the weight, and there is a change alignment. The normal alignment of the female knees are more in the the direction towards the valgus, what we say. It's that pointing outside, the knee pointing towards outside. So this angle is more in the females. So once this angle is more, the valgus angle is more, there is a higher predisposition for this sort of injury to happen. So the other thing is that it depends upon that which that sports activity the athlete is involved in. And if it is the contact sport is where there is a lot of dribbling and all, like the football, hockey, and the basketball. So in these, the injury pattern is different here because the lower torso is planted firmly and the upper torso moves, and there's a rotational strain over the ligament which causes the injury. And also, like I can give an example of those athletes taking part in the gymnastics. So once they land on the floor, if the landing is not okay, so they can easily injure this ligament. So our strategies are that during the training session, we also have to incorporate the preventive strategies for every sport, for every individual athlete, so that they don't undergo an injury. Because you can imagine a sportsman at that level, once he's reached a national or international level, he's come there out of a lot of hard work. And if he is not trained properly, if he is not explained the various risk factors and how he is to prevent the injury from happening, you can imagine that his career would be over, because once this injury is there, it takes some months, if not a year, for an athlete to come back to his normal athletic arena. So it is better to prevent this injury from happening rather than going for the treatment. And even if he's fully treated, then there's no assurity that he would be playing at the same competitive level. So it's very important that we have to understand that what are the risk factors and what are the prevention that can be done. So like I was saying, that for a gymnast, he is to be taught when he is to be landing on the floor, he should be landing on the toes, not on the heels. And his knees and hip joints should be flexed. It should not be extended. So if he lands on the heels with the limbs, with his knee joint and hip joint extended, there's every chance of his ligament getting injured. So all these, all the coaches in the various sports centers and the various athletes have to be trained so that our athletes don't get injured. Now, if the injury has happened, then how do we take care of a knee joint then? In that case, immediately the patient is immobilized, and he is not allowed to do any aggressive activity. He is subjected to various investigations and examination by a trained knee surgeon. So if he's found to have injured his knee, the ligaments, then he is put on a screened protocol, which is that he is to undergo light physiotherapy as advised by the surgeon, non-weight bearing, and has to be taken rest, because the first 3 weeks are very crucial. That's when the soft tissue injury takes its time to heal. Once the 3 weeks are over, then the patient is further investigated, further examined, and if the injury is serious, and we talk to the patient, and then we plan him for the surgery, which I will not go in detail for the ligament surgery, but then that surgery is important if there is a severe injury, because if we really don't fix the ligament and we leave it like this, we ignore it and let the patient do his routine activities, and maybe he's like running around and all. So he is likely to exacerbate the injury, and he's going to injure the structures which were not previously injured. So we have to really counsel the athlete that what all he's required to be done. If he's not properly counseled, he can injure his other structures like menisci. There can be early onset of osteoarthritis in the knee joint of the athlete. So that becomes the duty of a treating surgeon, that he makes aware of all the possibilities to the athletes and to the coaches and to even the young kids, like those who are in the school time and who go for various sports activities. I think our even the coach in the school or the sports teacher in the school should be well trained, that he should be aware of that what all injuries kids can undergo while in the school. So this was a brief description about one set of problem which our youngsters can face. Now I would be I'll be shifting my focus to another very important knee problem, that is the degenerative osteoarthritis, which is prevalent in elderly. So so my subject would cover the grandparents and the grandchildren staying at home. So now coming to the grandparents. So this is a degenerative disease of elderly, like after a certain age, our hairs start graying. So is the case with the knee joint, that after a certain age, our articular cartilage, which envelops the knee articular surfaces, it starts degenerating. And there are a set of problems which are secondary to some problem, and there's a group of disorder we call as a primary osteoarthritis, which has no clear-cut known factor. So the primary osteoarthritis is a degenerative disorder, senile degenerative disorders occurring in elderly without any known cause, and this is the most common form of the osteoarthritis. Other is the secondary osteoarthritis, where the known cause is known. Like the person could be suffering from the inflammatory arthritis, like rheumatoid, or could be having the infective pathology of the knee, or he has suffered from a trauma in the recent past, where the change alignment has occurred because of the malunions, so and so forth. So these are the known causes, and we group into the secondary osteoarthritis. But the treatment protocol, the treatment is for both the condition, whether the primary osteoarthritis and the secondary osteoarthritis goes hand in hand, and they are quite similar. So here again, we have certain risk factors which needs to be identified. So weight is something which is common in all the problems. So if you're carrying 20 kgs extra weight on you all the time, so you can imagine the amount of extra load you're putting on all your joint, especially the lower limb joints when you're walking around. So it is a good idea to reduce your weight. And how can the weight be reduced? This is by your diet control, by exercises, and by aerobics, etc. So the weight needs to be controlled at all times. So the second thing would be the deformities, which can happen as the age progresses due to the degenerative processes. The articular cartilage gets worn off and the deformities start appearing. So these deformities, most of them are when the knees start curving inside, called as the varus deformities. So these varus deformities are present 10 times more than the opposite one when the knees goes outside. So once this deformity has occurred and the bones of the lower end of the femur and the upper end of the tibia have started touching each other. Once you get an X-ray done, if you see the bones are touching, that is the stage which we consider as the severe form of osteoarthritis. And once this stage is reached, the total alignment of the body is totally distorted. Like you take an example of a vehicle which has 4 wheels. If one wheel alignment is distorted, you keep driving it, the other 3 wheels would gradually wear off. Similar is the case in our body. It works on the same mechanism. If our knee joints are turned inwards due to osteoarthritis, so this puts the stresses on the joints above the knee joints and the below the knee joints. And gradually the joints above knee, like hip joint, spines, and the below, like the ankle joint, the foot joints, they all start getting involved. So for that stage to reach, the patient has to be very ignorant. And a doctor, the treating surgeon also has to be very ignorant. But we shouldn't be allowing this stage to reach. So we usually divide osteoarthritis into 4 grades. The grade 1 and grade 2 are the ones where the milder form of the osteoarthritis, where the articular space is still present, but the patient is having pain and difficulty in walking. The grade 3 and the grade 4 are the ones where the articular cartilage has got degenerated and the bones are directly abutting each other and rubbing each other on walking. So we have to, once the patient comes to us, he is in the early stage of osteoarthritis, it becomes a duty of the treating surgeon that he should start the conservative treatment there and then. And that's how we can prolong the disease activity. We cannot halt it as once our hair start graying. We really can't halt it, but we can definitely delay it with a good nutrition, with good exercises. So is the case with the knees. Once you having a problem in the knees, there are a set of conservative management which should be instituted straight away so that the disease process gets prolonged. And he doesn't need a total knee replacement in a year or 6 months' time. So if it is started early in the onset of disease, we can easily prolong it, and he may not even require the surgery ever. So what are the conservative management? First of all, identifying the risk factors. Once the risk factors are known, and you have to be formulating the preventive strategies so that you don't end up in further aggravating your knee problem. The patient has to be taught the weight loss regimen. He is to be taught the regular exercises which are to be needed, and the low contact exercises are what is recommended. The high contact exercises like kneeling, running, brisk or running over the stairs, sitting cross-legs, and squatting, so these are not allowed. So low contact exercises like you can do light walking, the brisk walking, even on the flat ground is allowed. So, and the most importantly is the quadriceps strengthening exercises. The quadriceps is the muscle which is there in the front of your thigh and that crosses the knee joint. So this muscle strength is very crucial for the longevity of your knee. If you are able to build up your quadriceps muscle, your knee problems may not happen that early. If the quadriceps muscle is weak, all the weight is borne directly by the joint. So muscle acts as a guard to the joint, and it guards the joint from the excessive stresses which are subjected. So the other way of managing conservatively would be that if the patient is already having mild deformity, it's a good idea to put on those corrective braces. You can put on the silicone insoles with the outside wedges, so that the varus deformity, which is the inward curving of the knees, can be prevented further by putting the knee subjected to the stresses which go outside. So all these are so many conservative managements are available, which a surgeon should be advising the patient. So once these are done, but the disease still progresses, then as I stated already, if the patient reaches the grade 3 and 4, then if the bones are touching, then the patient should not be waiting any further and should not be continuing with the conservative treatment, because that can be really hazardous, because that puts the excessive stresses on the joints above and below the knee joints. So patient should be subjected to a surgical procedure to correct his deformities, to make the alignment back to normal. So this is in brief about the osteoarthritis, and I would be happy to take on any questions if you have for me.
If anyone has any queries, please feel free to drop your suggestions or your questions rather in the chat box.
आप लोग अपने questions डॉक्टर साहब से पूछ सकते हैं.
So I have a question, doctor. This is regarding walking. You know, it's nice to walk, but when we walk on the hard surface, and when we walk on the soft surface, what's the difference which is there, and what is the impact? Sometimes after you take a long walk, if suppose somebody walks for around 6 to 7 kilometers, there is some pain which is there in the calf or sometimes in the knee after walking on a hard surface. Why is that? Why does that happen?
Firstly, it is the rule of the thumb is that you should be walking below your fatigue level and the pain level. If you have walked to a distance, say around 2 kilometers, but you intend to walk 6 kilometers, if at 2 kilometers your knees have started paining and you have started that fatigue in your muscles, that's the time you should stop there and you should be resting. If you walk beyond this, that's the time when your knee starts getting your muscles start getting fatigued, and all the stresses are directly subjected on your knee, and that's how the knee starts coming in problem. I mean the knee joint. So that's very important, and if you really love walking, and if you intend to walk, so it's a good idea to be putting on a silicone insole in your shoes. So that makes it softer, and as you mentioned on the hard surface. So if you are walking on the hard surface, I would suggest that you should be walking with the sport shoes on and with the silicone insole inside your shoes. That would increase your walking distance.
Okay, thank you so much. But is when the pain comes, you don't realize the pain when you're walking, but the pain comes later. Probably, once you finished your walk and after an hour or so when you just rest. So that's okay. It means what you suggested, that the shoes and the insole, that is what is important to take care.
Absolutely.
Fine. Thank you so much.
One more question from Bhavna, ma'am. Please go ahead, ma'am.
Good evening, everyone. Good evening, ma'am. Good evening, sir. Sir, my mother got knee replaced 10 years back. It's around 10 years, yes. And she's again facing the knee problem. So what do you suggest about this second surgery, second knee replacement? What could be the possible reason? Because she is in Uttarakhand, I've not been able to check the reports and everything, but I'm quite worried for her. So can you just let me know what all things I can check or we need to check?
Yeah. So I would suggest that if your mother is having some problem after a knee surgery, and that too after so long, so it is important to consult a knee surgeon. It is important to get her X-rays of the knee joint done and get her CT scan done of a knee joint, because invariably a knee, if the weight is too much, if the weight is on the higher side, and if patient has been squatting or doing excessive high contact, those movements, so there's every possibility that the knee implant can get loosened. And other important thing for loosening of the implant can be the infection. So it is important to work around. And she may not have any of these problems. The pain would be just, a little inflammation in the synovial lining of the knee joint. So that can be easily managed. I mean, there are a number of, possibilities after a knee joint with the patient complains of pain and difficulty in walking. So she needs to be properly evaluated. So, starting from the various infection markers to the X-ray, to the CT scan, and to the physical examination by the surgeon. So I would suggest that you get her to the hospital, to a knee surgeon, and get her properly evaluated.
Actually, the thing is that we got her knee replacement in Mount Abu, and that's quite far from Uttarakhand. And now in COVID situation, we have not been able to take her there.
Don't worry,
It's not suggested to...
we have better surgeons in Delhi too.
Yes, sir. Definitely. Thank you so much, sir. I would definitely like to connect with you later on regarding the same.
Sure.
Thank you so much, sir. Thank you so much.
Thank you so much, sir. We have a question from Ms. Nimisha Gulati. Nimisha, ma'am, you could ask your question.
Yes. Hello. Good evening, doctor.
Nimisha, little bit louder.
Yes. Hello, good evening, everyone.
Hi.
Hi. Thank you, sir, for giving me the opportunity to ask the question. So I want to ask for somebody who is around 60 years of age. Actually, I wanted to ask about my father.
Okay.
So he has been suggested for knee replacement,
Okay.
but for some reasons we want to delay it. So what regime can be followed by him to keep their knees, to keep his knees in good condition till then?
Madam, as I have mentioned already, that if you have got his X-rays done in the standing position with a full weight bearing, and if the space between the two bones is not there and the bones are touching each other, so I think you shouldn't be waiting for the COVID to be over, because that's the situation which it's further course of that the progression of the disease is really bad, because it puts the pressure on the joints above and below the knee joints. And the most catastrophe is when the spinal nerves, they come into pressure because of the excessive stresses on the spine. So this can lead to nerve compressions and big problems, including the loss of urine control as well. So, but having said that, it's not that you come tomorrow for the surgery. You need to plan and you need to do all those things. So till that time, it is important that he should be undergoing a physiotherapy regime, which in the form of the quadriceps strengthening exercises. That's very important. And he should not be walking too long, and he should not be standing the whole day long. He should be resting till he undergoes a surgery, because more he walks, more he is subjecting his joints above the knee and below the knee to the unnecessary stresses, and which can get damaged in due course of time.
Okay. Okay. Thank you so much.
Thank you, sir.
Sir, I have a query. Is it a myth or a fact that after certain age, one has to undergo a knee replacement, maybe after 70 years or 75 years, or it depends on the person to person only?
No, I think it's a myth only, because
Okay.
we are not fond of doing knee replacement to everybody, anybody who comes to us.
Okay.
So like any other surgery or any other medical intervention, it is not done unless it is really indicated. As as the madam who just was talking about her father, that he has already been advised on knee surgery. The surgeon would have advised because of the specific indications, and there are specific indications for the surgery. If your knees are not paining, and if you have no problem, then you don't have to undergo a surgery at all. There are people at the age of 90 and above 90 and 80 years who are active joggers who have been running around. They are absolutely fit. Not that like our most of the time, like hair start growing after 40, so all knees will get bad. It's not like that. It's only a percentage of few who would end up having an osteoarthritic problems. So don't worry, not everybody requires knee replacements.
Thank you, sir. Thank you.
Thank you, sir. We have a question from Mehravi ma'am.
Yeah.
Mehravi
Like to
ma'am, you
ask,
could, yes.
yes. Am I audible?
Yeah, please
Yes.
go ahead.
Okay. So I have three questions. First question is regarding my mother. My mother is having sciatica. So whenever she
Okay.
goes on walk, she is suffering from sciatica. She is having sciatica.
Okay.
Okay. Yes. So whenever we are going on a walk, after coming from that walk, my mother is having severe pain in her legs.
Okay.
Is it okay for my mother to go on a walk?
Well, not really, because if she's a known patient for sciatica, and the pain gets aggravated on walking, then obviously it is not desired for her to be walking around. In fact, she should be resting, and she should be undergoing MRI of her spine to see what is, we need to quantify the problem, you know. So and she needs to be examined by an orthopedic surgeon. If there is a nerve compression, and that the most probable cause is usually the disc, which is prolapsed, and that goes on pressing on the nerve roots in the spine. And if the patient keeps doing those activities like prolonged walking, forward bending, and all those things, and straining, so that prolapse goes on increasing, and so is the nerve compression will go on increasing. And once the nerve compression is increased, then for the prolonged nerve compression, there is a wasting and atrophy of the muscle which start. So I would suggest that the patient should undergo MRI of the lumbosacral spine, and should be consulted with an orthopedic surgeon. And if the compression is mild, then she can be treated conservatively, which goes on to 6 weeks of treatment along with bed rest. And if the compression is too much, then she may need a surgical procedure as well.
So one more question. My father is having, whenever he's trying to bend his knees, he is not able to do that. He is having severe pain, और फिर कभी-कभी उनको काफी उसको मसाज करना पड़ता है knee को, just to bend his knees.
Okay. So,
Yes, sir.
As you're saying, the bending is where the kneecap, which is not usually called as the patella. The bone is called patella, which is a bone, a sesamoid bone in front of a knee joint. So that the articular surface of patella and the femur, called as a patellofemoral articulation. So that is the first joint. The femur, our knee joint is a multi-joint. It's not a single joint. So the patellofemoral joint is the first to be involved. So the arthritic changes, they appear usually in the patellofemoral joint. And the first sign is that patient gets pain once he's trying to sit in a chair, he gets off the chair, once he climbs the stairs or he goes down the stairs. So if that's the place he's having pain, so that is indicative of the patellofemoral arthritis, which is the early form of the osteoarthritis. So as I mentioned earlier, as if we are able to, subject the patient to proper conservative regime during this stage, during very early stage, which is a grade 1 or a grade 2 stage, so we can prolong the progression of disease, and he may be all right. Not need a surgery ever.
Okay. Yeah. And sir, my last question is regarding myself. So whenever I'm bending my knee, like suppose if I'm sitting for a very long time and when I get up, I hear some sound from my knee.
Yeah. So
yes. So sir, what is the reason for that?
That is just a laxity of your ligament. You don't have to really bother about that. Just that you need to do some, the strength, muscle strengthening exercises. Once your muscles become of good strength, so this musical sound which is coming in your knees will gradually wane off.
Okay, thank you so much, sir.
Yeah.
We have a question from one of the participants. She asks, if somebody has a history of arthritis in the family, what precautions should they take?
The arthritis is, yes, it has a genetic component in it. And if somebody in your family is having osteoarthritis, so you should be knowing that it can happen to you as well. So as I mentioned earlier, you should be undergoing the conservative regime, which in the form of, you don't need any medical treatment as such. There's no medical treatment required unless it is really indicated. So if at all you have pain in the knee joints, you may be at any age, so you should get your x-rays done of the knee joint in the standing. You should consult an orthopedic doctor, and you should be doing the muscle strengthening exercises. And it's not that if you don't have a pain or if your knees are perfectly all right, you need not be sitting at home if somebody in your family is suffering from osteoarthritis. You're absolutely normal and you live a normal life. You go on for jogging, running, and whatever you want, you can do. It is just that once you start having some symptoms, you start having some problems, then you need to be really be worried and start taking care of yourself. Otherwise, if somebody is having osteoarthritis in your family, I will not suggest that you stop squatting or stop climbing stairs and stop running or stop jogging. So you live a normal life. You may not have it only. It's not that anybody in your family is having, you will also have it. It's not so.
So, sir, should we be taking any supplements, or do you think there is a right age from when you should start taking supplements like glucosamine or something?
No, as I said, medical therapy is not indicated at any age, whether in the younger or elderly, unless it is really indicated. And glucosamine is indicated at the very early stage of osteoarthritis in the grade 1 and grade 2 stages only. And that too, I don't know how much effective it is. It may be just a placebo, because just a subjective feeling to few people that I'm taking some drug, so I cannot, so nothing can go wrong to my knees. So it may just be a subjective feeling of wellness after taking glucosamine, which may just be a placebo. So moreover, the drugs are not given haphazardly, because there are certain studies which have shown that this may increase the blood glucose level, and there can be cross allergies if you are allergic to seafood as well. So don't really go for any medical therapy unless it is really indicated, and unless orthopedic surgeon has really.
Thank you, sir. Another participant, Ms. Priyanka Singhal, wishes to ask a question. Please go ahead.
Good evening, sir. Sir, actually, my question is for myself. I developed this problem of knee pain at the age of 30, immediately after my delivery. And one of the possible causes, definitely, it's overweight, because I am slightly overweight. So, sir, every time, like, I've got my x-rays and everything done, so the doctor said that there's no problem with the joint as such. And they've just asked me to reduce my weight. But every time I start with any kind of exercise or go for a brisk walk, the pain aggravates. So because of which I have to stop it there and then. So what is the reason? Because it has become cyclical. I'm not able to reduce my weight because of my knee pains, and then the knee pain is not going because of my overweight. So how should I go about it, sir?
So firstly, it's a good idea if you're overweight to reduce your weight. And also, along with the weight reduction regimes, you should also be doing the muscle strengthening exercises, which are very important. Once you do once your quadriceps muscle strength is good enough, you may not need administration of any drugs. Your pain will start reducing, and you will be able to walk a longer distance gradually. And it's a good idea, as I mentioned earlier, that if you're walking on a hard surface, you should be putting on sports shoes with silicone insole, and you should not be doing walking beyond your pain and fatigue. And you shouldn't be standing too long. And also, I would suggest that you should be getting examined from an orthopedic surgeon to rule out any nerve impingement in your spine. Because many a times the problem is in the spine, it is not in the knee joint, because the pain from the spine, it travels from the back, goes down your thighs, goes from the calf muscles, and down below, behind the knee joint, down to the toes. So many a times, invariably, people go on thinking, I have a problem in my knee or in my calf muscle, but the actual problem is somewhere else. That's in the spine. So you should rule out after getting examined by an orthopedic surgeon that if your spine is perfectly fine. If it is fine, then it is just the lack of muscle strength, which is the actual cause of your knee pain. So if you do the strengthening exercises, and I'm with your weight reduction and other things like a few protective things like sports shoes and silicone insole, I'm sure the pain will go down.
Thank you so much, sir. Thank you.
Thank you, sir. We have one more question. To what extent is backwards walking beneficial?
Well, the backward walking is just that, I mean, it helps you build up your muscles of the thigh on the back side. And so there's no harm if you can walk backward without falling.
Okay, thank you, sir. Do we have any more questions? Yes, one more question we have. What can be done for age-related knee pain which is not very severe?
Age-related knee pain, which is not very severe, is that you have to investigate the patient. You have to, if the patient is elderly, you can give him, if it is a mild osteoarthritic changes, exercise, and then you can start few drugs also, like paracetamol can be given. And the combination of paracetamol and tramadol is safer for elderly people. And if it is a nerve impingement starting from the back, you need to start few nerve medicines, So all these things can be done. Yeah.
Thank you, sir. Any more questions?
Any more doubts to be clear?
I think I've cleared all doubts.
Yes, absolutely.
Just one more thing, sir, I want to ask. Sorry,
I also
you can
have one
continue.
question. I also have one question. My mother, she got her knee replaced few years back, but it's been like 5 years from now. But she still have pain in one of her knee. So, what precautions she can take to like minimize that pain?
Firstly, it's as I've mentioned again and again, she needs to be coming to a surgeon, because we have to rule out the cause of the pain, which is very important. We cannot be saying, okay, it's just a one-off pain, forget it. Take some analgesics and go on, because she's already she had a knee replacement, and we have to rule out the pain. If the patient was painless after surgery and she suddenly becomes painful after a few years, so we need to be evaluating the patient properly to rule out, a set of problems which are common after knee replacement after a few years, like infection. It can be a loosening of implant. It can be, periprosthetic fractures if she had a fall, and there can be the reactive inflammatory arthropathy of the joint. So all these things have to be ruled out. So she needs to be a visiting hospital to a surgeon to be evaluated.
Thank you so much, sir.
I guess one more participant was asking a question. Please go ahead.
I just wanted to know regarding the calcium intake for kids as well as for the elders.
Yeah, calcium intake for the kids is for the growing age is important, and should be prescribed by the pediatrician. Should not be taken rampant at any age for that matter, and also for the younger age groups or elderly. You need supplements only if you're deficient of that. If you're not deficient of that, taking those supplements may not help you. It may rather harm you for somewhere. So it's a good idea to get your blood tested for calcium, and like vitamin D and phosphorus, all these minerals. And if you're found to be deficient, then it's a good idea to take them, not otherwise.
Okay, thank you so much, sir. Just one last question. Like the adolescence age, like the kids when they start gaining their height, what role the calcium plays? Like they need to take something extra or some exercises, or it's just fine, like their normal routine is fine. There's nothing to do.
Madam, as I said, it's I am not very fond of giving medicines unnecessarily. Our diet is fully loaded with all the minerals. If you have a proper dietary pattern, actually you don't need any supplements whatsoever, you know. And
Thank you so much, sir.
you
Thank
should,
you so much.
a patient should undergo those tests, as I said. If he or she is deficient of some mineral, then it's idea of taking some extra supplements.
Thank you, sir. Thank you
Thank you
so
so
much.
much, sir.
Thank you, sir. There's one last question from Ms. Richa. She asks, is there any special care that is recommended for someone who has just recovered from COVID?
Yeah, COVID, once somebody's recovered from COVID, so as somebody had sent a message few days back that it's only the pregnancy and the fractures which are spared from the COVID. You know, you can have everything with the COVID except a pregnancy or a fracture, you know. So we are one of those. So if you have had COVID, so you won't sustain a fracture, you don't worry, you know, you just live a normal life. And yes, if you need to undergo a surgery, and if you are found to be COVID positive, or if you just recovered from COVID, then there is definitely some weakness there in the body. So it is a good idea to, you know, prolong that surgery for some more time till you regain your strength, because it is a viral disease which is incapacitating, and the vital capacity of your lungs go down, and any surgical procedure during this time maybe not be good for the patient. So maybe it's a good idea to wait some time, you know, to undergo surgery. That is the only thing which is there for any patient who has recovered from COVID. Otherwise, he's absolutely okay to live a normal life.
So thank you, Dr. Chaudhary. On behalf of the entire SRGS family, I would like to thank you. You've got such a busy schedule, and in spite of that, you've spared so much time, and you've actually answered everybody's questions. And on behalf of each one of them, I'm really, really thankful. And we look forward to seeking help from you. And for all the audience who are present, I would like to tell you that, Dr. Chaudhary had operated my dad, and my dad is walking just because of him. Because not only as a doctor, but as a very good human being, he went ahead and he helped him. And, we tried to go to the best doctor, the name which was coming on the top. I'm not saying Dr. Chaudhary is not the best, but the name which was reflecting on the top, the doctor was not even sensitive to tell even the precautions. But when we went to Dr. Chaudhary, he told us the minutest of the precautions which are there, which are supposed to be taken. So whenever our elders, or probably we, need to go and consult a doctor and to go for a surgery, we need to see that having a big name is very important. It's very important to see that the surgeon is very good, but at the same time, we also have to see that the person is very, very sensitive to our needs, so that, our elders, or probably we'll also be going through that time, that we can recover fast and in a much better way. So with this, once again, thank you, Dr. Chaudhary. Thank you so much for sparing your valuable time, and we're really grateful to you. Thank you.
Thank you, sir.
Thank you, sir. Thank you for sparing your valuable time for Shriram Global School. And thank you all, dear friends and colleagues, for making your initiative. With the more initiatives in the coming weeks. So till then.
Yeah. Okay. Bye. Thank you.
Yeah.
Thank you, sir, for sharing your valuable information about injuries, health. Thank you so much, sir.
Shall I end the meeting?
Yes, sir. Yes.
Yes, sir.
Okay.
Thank you, sir.
Okay.